Well, thank you, Barbara. So I'd like to thank everybody for coming today and sharing actually in this sort of very exciting time period in the surgical treatment of advanced heart failure. So yesterday morning at the American Heart Association and simultaneously published in the New England Journal of Medicine is what's really considered to be a groundbreaking trial in the surgical therapy for end-stage heart failure. What we presented and simultaneously published are the results of a 4-year trial looking at the use of a newer sort of miniaturized continuous flow pump for the treatment of heart failure. So these new pumps actually take over the work of the heart and restore normal hemodynamics and flow. What we found with this newer device called the HeartMate 2 left ventricular assist device is that it was a significant improvement over its predecessor, the XVE, which was a larger pulsatile pump. It is still pending FDA approval, which hopefully will be coming soon, but what we've been able to demonstrate is that it is appropriate, safe, and effective for long-term or permanent use, or what we currently refer to as destination therapy. The findings of this study and presentation were very significant from many points of view. So one is, compared to the old device, we've been able to show a significant improvement in survival as well as a reduction in adverse events. Equally important that we pointed out actually in our presentation and discussion of the paper is that there really have been no significant changes in outcomes in advanced heart failure with current medical therapy. So the idea now is, whereas the overall survival in end-stage heart failure with medical therapy is less than 10%, we can show close to 60% survival at 2 years. So this is a significant improvement for patients with advanced heart failure. The other is that these devices will now be able to be used for permanent use. Up till now, they've only been approved for what we'd call sort of midterm or temporary use, and that is for bridge to transplantation. So now for patients that are not transplant candidates, they will have access to this new technology, which improves overall outcome and survival. For demonstration purposes, initially what we have here, this was the original device that is currently the only approved device for long-term use or destination therapy, which was a pulsatile flow device. It sews into the apex or tip of the heart and then restores blood into the aorta. But as you can see, it's a relatively large device. It does mimic, so it does mimic the actual sort of pulsatile flow of the heart. But obviously is a relatively large device and to some degree limited who it could be implanted, particularly women and potentially teenagers. The new device that was just under study was the HeartMate 2 device. So it is approximately 1/3 the size. It is significantly smaller. It only has 2 touching parts, so there's essentially no moving or touching parts, therefore has much longer durability. Its attachment to the heart is very similar, but requires much less surgery due to its size. As I pointed out, the other important part is its durability. It is a continuous flow pump, and what that means is that actually there is no pulsatility. So most of these patients are now pulseless, and we've learned that actually patients do quite well with diminished to no pulse. So this has been a great advance because before this, we had to use the larger pulsatile devices for patients. It was limited in durability, and now patients have access to this new technology with improved survival and reduced adverse events.
I feel honored to be here today. I'm very lucky to be here today. In June of 2008, I was on my deathbed. I didn't know anything about an LVAD. But after receiving the surgery on June the 5th, 2008, I had a long recovery. And through that recovery, I was able to get back the life that was slipping away from me. I can now go fishing, hunting, go to church, go to conventions, go walk the mall, walk miles, exercise. I can do just about anything except go swimming. The pump doesn't like that. I can't climb mountains, but every day to me is a day that I get a chance to live, breathe, and do whatever God's will would be for me. I want to thank Dr. Slaughter, and all the nurses and doctors at Jewish Hospital, because you can have the best device in the world without the great doctors and great nurses. It wouldn't have been a success. But I had the best teams working for me.
We have counted every single day as a blessing with this device. This device has given us a life together that otherwise would have ended over a year and a half ago. And I'll never forget that day of surgery, laying my head on his chest and listening to his heart. And I heard it beating, and I thought to myself, I'm not going to hear that again until after he gets a transplant. But you know what? Today, when I lay my head on his chest and I hear that wonderful hum of that VAD, that pulsing, or the lack of the pulse, doesn't bother me. It is a wonderful thing because it is a life-giving device. And for that, we are truly grateful. And we're grateful to Jewish Hospital. We're grateful to have been a part of this study and to continue to be a part of this study, because we have every day that we give thanks for now, and we live it to the fullest.
The idea is, once again, we're just very excited. It's just another example of the sort of exciting care, technology, and therapy that we can provide with the combined efforts of Jewish Hospital and the University of Louisville.